Does this all instantly restore blood flow to the legs? What's really happening to the blood vessels? Many people perceive cold feet, tingling, heaviness, and rapid fatigue as a normal sign of aging. However, these symptoms may conceal complex processes related to microcirculation, the condition of the vascular wall, and the functioning of the peripheral nervous system. In recent years, claims have increasingly emerged that a particular oil can instantly restore blood flow and restore lightness to the legs in just minutes. But how closely do such claims align with modern scientific understanding? One of the most discussed remedies is mustard oil. Its chemical composition includes unsaturated fatty acids, natural antioxidants, and compounds with a local irritant effect. When applied to the skin and followed by massage, it dilates the superficial capillaries. A person feels warmth, the subjective feeling of cold is reduced, and local tissue perfusion temporarily improves. This effect is often perceived as restoring blood flow. However, it's important to understand the difference between enhancing superficial microcirculation and eliminating true vascular disorders. If discomfort is caused by spasms of small vessels, a sedentary lifestyle, or prolonged sitting in one position, massage with oils can indeed temporarily improve well-being. Increased blood flow to the skin and muscles is accompanied by a feeling of lightness and reduced tension, but with atherosclerotic lesions of the arteries of the lower extremities, the situation is fundamentally different. Atherosclerotic plaques form within the vascular wall over many years. No oil can dissolve them in minutes or restore arterial lumen after severe narrowing. Furthermore, thrombotic complications pose a serious risk. In such cases, self-medication can lead to a loss of time, whereas the patient requires a comprehensive diagnosis, vascular ultrasound, ankle brachial index assessment, glucose monitoring, and blood lipid profile. Why do people still report positive effects? The answer lies in physiology. Warm oil combined with massage stimulates skin receptors, activates local mechanisms regulating vascular tone, and promotes muscle relaxation. As a result, the feeling of stiffness is reduced, fatigue is alleviated, and the subjective perception of leg health temporarily improves. Some oils, including olive and flaxseed, are also considered cardiovascular nutritional. They contain mono and polyunsaturated fatty acids, which, when consumed regularly as part of a balanced diet, can have a beneficial effect on lipid metabolism. However, even this effect develops gradually and bears no resemblance to promises of instant healing. Modern vascular medicine points to several factors that truly influence blood circulation in the lower extremities: quitting smoking, regular walking, weight control, maintaining normal blood pressure, managing cholesterol levels, and promptly treating diabetes. Therefore, the claim that any oil can instantly restore blood flow to the legs is a gross exaggeration. Natural oils can be used as an adjunct to massage and temporarily improve comfort. But when it comes to true vascular disease diagnosis, evidence-based treatment methods, and risk factor management are crucial. That's why the main question isn't which all works miracles, but rather, what processes are actually disrupting blood flow to the legs? And why does the body begin to send warning signals long before serious complications arise? One of the first signs of impaired blood flow to the lower extremities is so-called intermittent claudication. A person walks a certain distance, after which pain, a feeling of fullness, or extreme fatigue appears in the calf muscles. After a short rest, the discomfort disappears, but then returns. This symptom is due to the fact that during exercise, the muscles demand more oxygen, but the constricted vessels are no longer able to provide the necessary blood flow. The development of atherosclerosis begins long before pronounced symptoms appear. High cholesterol, smoking, chronic inflammation, and hypertension gradually damage the lining of blood vessels. The body attempts to restore its integrity, but lipids simultaneously begin to deposit in the arterial walls. Over time, atherosclerotic plaques form, narrowing the vessel lumen. Interestingly, many people with significant vascular changes may remain unaware of the problem for years. The body's compensatory mechanisms allow it to maintain sufficient blood supply even with significant narrowing of the arteries. However, when a critical level is reached, the reserve capacity is exhausted, and the symptoms begin to progress rapidly. Often, patients attribute numbness in their feet to bad weather, age, or uncomfortable shoes. However, a constant feeling of coldness in the legs, changes in skin color, hair loss on the legs, delayed healing of minor injuries, and night pain may indicate serious disorders of peripheral circulation. Microcirculation deserves special attention. This is a complex network of tiny vessels, arterioles, capillaries, and venules through which oxygen, nutrients, and metabolic products are exchanged, even in the absence of large atherosclerotic plaques. Disruption of the microvasculature can cause severe discomfort. Such changes are especially common in people with diabetes. Elevated glucose levels damage the vascular wall and nerve endings. As a result, diabetic neuropathy develops, accompanied by burning, tingling, decreased sensitivity, and a crawling sensation. That is why experts recommend that patients with diabetes regularly examine their blood vessels and take good care of their feet. Why do various oils continue to be popular? The answer lies in a combination of several factors. Firstly, massage really improves local blood circulation. Secondly, heat helps relax muscle fibers and reduce vascular spasm. Thirdly, the self-care ritual itself reduces stress levels, which also affects vascular tone through the nervous system. However, it is important to understand subjective improvement in well-being does not always mean elimination of the cause of the disease. A person may feel warm and light after the procedure, but the pathological process inside the vascular wall will continue to develop. Physical activity plays a special role in maintaining normal blood flow. While walking, the calf muscles work as a kind of pump, helping venous blood rise up against gravity. Regular walks stimulate the formation of collateral vessels, additional blood supply, routes that can partially compensate for the lack of blood flow. Research shows that even moderate daily exercise can have a positive effect on the condition of the vascular system. We are not talking about intense training, but about systematic activity, walking, swimming, exercises for the feet and ankle joints. Nutrition remains an equally important factor. Excessive consumption of saturated fats, trans fats, and high-calorie foods contributes to lipid metabolism disorders. At the same time, a diet rich in vegetables, whole grains, fish, and sources of unsaturated fatty acids is considered one of the elements of the prevention of cardiovascular diseases. You should also be aware of the effects of smoking. Nicotine causes vasospasm and damages the inner layer of the arteries. People who smoke have a significantly higher risk of developing peripheral artery disease, and the progression of existing disorders occurs more quickly. That is why experts are increasingly talking about an integrated approach. There are no magic remedies that can restore youth to blood vessels in a few minutes, but there are methods whose effectiveness has been confirmed by numerous observations. Control of risk factors, timely diagnosis, physical activity, and compliance with medical recommendations. And perhaps the main conclusion is this: if the body regularly gives signals in the form of pain, numbness, or a feeling of coldness in the legs, you should not look exclusively for miracle all. It is much more important to understand what mechanisms underlie these symptoms and what exactly the vascular system is trying to tell us long before the changes become irreversible.